In this video, I will discuss valproic acid. So, valproic acid is a broad spectrum anti-epileptic drug. Here, broad spectrum means it can be used in different types of epilepsies. It can be used in bipolar disorder and also it can be used for migraine prophylaxis. Migraine prophylaxis can be done by using valproic acid. It is available as valproic acid, sodium valproate and divalproic sodium. These are different names for valproic acid. Mechanism of action. It actually increases the GABA levels by inhibiting GABA transaminase, and this GABA is an inhibitory neurotransmitter. So seizures are produced due to excitation. So this inhibits and therefore helps controlling seizures. It also blocks voltage gated sodium channels, and in this way action potential generation is stopped. It also inhibits T-type calcium channels. T-type calcium channels are required for generation of the action potential, and when these are inhibited, then action potential generation is also inhibited. Net effect is it stabilizes the neuronal membranes and prevents seizure spread. Pharmacokinetics. It is orally well absorbed. It can be given intravenously. It is metabolized in the liver. Therefore, in liver disease, it is contraindicated. In liver disease, it is contraindicated. It binds to protein. Almost 90% of it is bound to protein, and half-life is 8 to 72 hours. That's why it is given in the BD dosing, twice daily dosing. It is indicated for different types of epilepsy. First line for generalized tonic-clonic seizures. It is also first line for absence seizures. Along with histosuximide, valproic acid can be used with for absence seizures. Myoclonic seizures. It can be used for these myoclonic seizures for partial seizures as second line therapy, and for certain psychiatric disorders, that is bipolar disorder. Patient has bipolar disorder, you can use valproic acid, you can use carbamazepine. You also can use for migraine prophylaxis if other agents that are given for migraine prophylaxis are not effective. For example, if you are giving propranolol or if there are contraindications to their use, you can use valproic acid for the migraine prophylaxis. Dosage. Initial dosage is 10 to 15 mg per kg per day. So if you have a 70 kilogram person and you are giving 15 mg per kg, then almost its tablet comes in the form of 500 milligrams. So you can give in the BD dosing. Maintenance therapy up to 60 milligrams per kg per day, that is the maximum dose in 2 divided doses, can be given as maintenance therapy. Therapeutic serum levels are 50 to 100 micrograms per ml, and mostly these are not done in most of the centers, therefore these are not very much important. Adverse effects. Common adverse effects that are mostly seen with most of the drugs are nausea, vomiting, but tremors are seen with valproic acid, and these tremors are fine tremors, weight gain, hair loss, alopecia. So weight gain and alopecia are also seen with this valproic acid. Serious adverse effects include hepatotoxicity, especially in children less than 2 years. So try to avoid it in children less than 2 years because it is hepatotoxic. It can lead to pancreatitis, but these are less common. Thrombocytopenia is also seen with valproic acid. Other drugs can also cause thrombocytopenia like NSAIDs, aspirin, etc. And valproic acid is teratogenic in nature. It leads to neural tube defects and you should avoid these in pregnancy. Hyperammonemia is also a side effect for valproic acid. Contraindications. It is a category D drug because it causes neural tube defects. Therefore, it is contraindicated in pregnancy It is also contraindicated in liver disease because it is metabolized in the liver disease, and also urea cycle disorders are also contraindication for this valproic acid because it leads to hyperammonemia if there are uric cycle disorders. Drug interactions. It has a lot of drug interactions. It displaces other protein bound drugs because it is mainly protein bound drug. For example, phenytoin is when displaced from the proteins, then its effect is enhanced but half life is reduced. It inhibits the metabolism of lamotrigine and phenobarbital, and therefore when you are co-administering lamotrigine with valproic acid, then you should remember that you have to decrease the dose of lamotrigine because it inhibits the metabolism of lamotrigine and phenobarbital. And you should also avoid with carbamazepine because both are hepatotoxic in nature, and therefore you are increasing the hepatotoxicity by combining these two hepatotoxic drugs. So this is all about valproic acid.